Hello, friends. My name is Peggy with Hormone Therapy Hub, and today I'm super excited because I'm going to share with you a company called Joi Women's Wellness. And I've been on their hormone replacement therapy since the end of March, and I could not be more pleased. I love the process, I love the testing and the information that I'm getting from that, and I love the product. So I can't wait to dive right in and just share with you everything that I'm super excited about. I'm going to talk about the products that they prescribed. I'm going to talk about their process to get started. And then I'm also going to talk about pricing because I know that's super important. So let's just dive right in. So the first thing I'm going to talk about is what they prescribed to me, just so you have a ballpark idea before we get started. So the first thing they prescribed to me was estrogen patches, and you basically just take the estrogen patch out of the container and you pull the backing off of it, and then I just put it somewhere on my torso, high enough that the waistband of my shorts or my jeans don't bother it, and super easy peasy. I do that every 4 days on Tuesday and Friday. The second product they prescribed to me is a progesterone cream. And this, I just do 2 pumps on the inside of my arm, and I do that every night before I go to bed. So again, super easy. The third product, not that it's not easy, but it was a little intimidating at first. So this is testosterone liquid. And what I do is obviously put it into the syringe. I take 20 units and I do that 1 time per week. And I'm also on the Joy semaglutide injection. So this is the first time in my whole life that I've had to give myself, other than I was trying to get pregnant, this is the first time I've had to give myself injections like in the last 30 years. And again, this is a little intimidating, but once you get used to it, it's not a big deal. I typically do it in my torso because that's where I have the most amount of fat. And I just bunch some skin together. I jam in the needle, push down the plunger, and it's good to go. It really has very little pain at all. So those are the products that they put me on. So let's talk first about the process to get started with Joi Women's Wellness. So Joi Women's Wellness was started by a gal by the name of Katie Whalen, and I've heard her on a couple podcasts. She's a lovely lady, and if you can find some podcasts, I suggest you listen to her because she's a wealth of knowledge. Her husband also has a similar company that they call Blokes, and so it's the kind of counter version of the men's version of kind of hormone therapy for men, and hers is the hormone therapy for women. They also do peptides. So I also started on a semaglutide, which is a weight loss drug. So I'll talk about that in a future video. But what I had to do is I went to their website, and I encourage you to use the link below, because if you use the link below when you register and you go to pay for your lab work, because you have to do that ahead of time, you will get 10% off. So be sure to hit that link below. So anyway, I did my registration, did my intake form, and I had to choose which of the blood test panels I wanted to do. And any one of the three will work for hormone replacement therapy. So the minimum test is $99, and that's called just a hormone test, and that tests 44 biomarkers. The medium-sized test, which is the one I did, they call their hormone, metabolic, and thyroid panel, and that costs $249. And then their comprehensive panel, which tests 74 biomarkers, is $599. And so to me, that seemed a bit exorbitant. But again, it really depends on what you're looking for. If you've got lots of questions or lots of symptoms and just things that you want to learn about, the doctors at Joi will be help you to work through all of those test results. So I chose to do the 249 hormone, metabolic, and thyroid test. And once I paid for that, and again, don't forget to use your coupon. Once I paid for that, then they sent me the orders. And so the orders came in just an email, and I basically had them on my phone. And so I went to a local LabCorp and was able to show them the orders on my phone. Actually, I had to forward the email to them so they had it. And that told them everything they needed. And of course, they just did the blood draw and obviously took the amount of blood they needed for the test panel that I chose. And then about a week later, I got an email from Joi that said they had my test results back. And as a matter of fact, I also got an email from LabCorp that same day. So the same test results that were emailed to Joi were also emailed to me, which I love because it's like, don't be hiding that information from me or sending it to my doctor and not letting me look at it. So then what Joi did is once they got the results back, they sent me a link so that I could register to basically schedule an appointment. And so I met with, about a week later, I met with a doctor. Her name was, I think she was a physician assistant. Actually, her name was Brooke, and she was lovely. And Brooke and I had a great time on our conversation. But she actually allowed 30 full minutes for our conversation. And our conversation was pretty extensive because I had already been on another company's hormone replacement and I was okay with it. I wasn't unpleased, but I really just wanted to see what Joi was about. Obviously, this is kind of what I do. And so I wanted to see how their process worked and kind of what they would recommend. And so we talked about the fact that I was already on hormone replacement and the fact that my levels were still pretty low in some areas. My estrogen was still kind of low, my progesterone was still kind of low, and my testosterone was tanked. And I wasn't on testosterone before. So this is the first time I've been on testosterone for several years. And so she and I talked about all those things, and she said, "Yeah, I think we can make things a little better." And I told her that I preferred to be on a patch for the estrogen versus a cream. So she wrote that down. And so, yeah, we kind of came up with a plan. And she's like, you'll get an email from us that kind of has all the costs and the options in it. And she said, "Is there anything else you want to talk about?" And I said, "Well, yeah." I said, "I still have like about 12 to 15 pounds I'd like to lose. And I just can't seem to get it off because I recently quit drinking. And now I've got this huge sweet tooth and I just can't seem to get my eating under control." So then she and I got into a conversation about semaglutide. So semaglutide is the generic version of Ozempic. And she recommended that maybe I consider that. She gave me the pros and cons of what the medication could do. And she said to me I could lose up to 10%, maybe even 15% of my body weight, but probably 10% since I really didn't have that much to lose. And so we ended our call that she was going to have some people at Joi send me some paperwork and some options, and so I can make some decisions. And so the very next day, I got an invoice from Joi where I got to make some decisions. And so that's where I decided to go with the patch and the progesterone cream and the testosterone injection. And then I decided to go ahead and go all in, and I also did the semaglutide. And I did basically 4 months worth of that. You can buy a 2 month, 4 month, 6 month, or 8 month version of the semaglutide. So after I paid for my bioidentical hormones, and that's what Joi does is bioidentical, and I did pay for those using my HSA card because Joi does not take insurance, but they do take HSA cards. And within, I think it was right at 10 days, and they kind of warned me it would take a little hot minute to get my products to me. So within 10 days, I had the products, and then I was able to start my testosterone injections. I was able to begin the estrogen and the progesterone. And I'll be honest with you, I feel great. And then about 8 weeks into it, they sent me a reminder email and said it was time for me to do my follow-up testing. So there's different plans you can purchase, and I'll speak on those in a minute. But the one plan, the one that's the all-inclusive plan, includes testing as you progress. And so if the doctor needs to make tweaks to the amount of estrogen or the amount of progesterone or the amount of testosterone or just tweak your regimen completely, they've got the data that they need to be able to make those changes. And I'll be honest with you, that is one of the things that for me is super important. One of the hormone companies I was on recently just uses your symptoms as the way to measure if things are working well or not. So they ask you some questions, you get some products, and if you feel better, they say they're working, but they never test your blood level, and they don't do any of that. And so when I got that first test back from Joi, even though I was already on another company's HRT, my estrogen was still low in Joi's opinion, and my progesterone was still low in Joi's opinion, and my testosterone was super low based on Joi's opinion of kind of where your levels need to be. So again, every company operates a little different, but I think it feels like because they've got the numbers and the data, they can be more confident to do maybe a higher dosage of estrogen or a higher dosage of progesterone because they've got the data to back it up. And I really appreciate, and that's really important to me. And so, yes, I know that adds some additional cost to your hormone replacement therapy. But for me, it's also the assurance that what we're doing is working, that it's not too much, because let's face it, we don't want to have too much hormone either. We don't want to be like we're 25 again. And so it needs to be just right. And the only way in my mind to really feel confident that it is just right is to look at those blood levels. So Joi offers three different packages. So they've got one package that they call a la carte, and it's like $89 per month, and you basically get one product, and it's typically either testosterone or estrogen, so depending on what you want. And in many cases, if it is estrogen, they can write you a prescription, and you might be able to use your insurance. And that one, they kind of say it's up in the air. It really just depends on your insurance provider. And then they've got a middle package, which is like $129 per month. And that package includes two products. And so probably your progesterone and your estrogen could be included in that. And that's good, again, if you're only just using basically two products. But if you feel like you're going to want more than that and you want future testing, I did their all inclusive, and their all inclusive is 189 per month. And that 189 per month includes all of the products you just saw and my testing as I progress. So I assume every 2 months or so we'll do additional testing. I also I emailed Joy about 3 days after I got my products and realized that one of the things that Dr. Brooke and I talked about was an estrogen cream for, down there, and it didn't come with my original package. And so when I emailed them, they said, okay, well, if you want it, because you're doing the all inclusive, we'll just add that. We just need to write the prescription, send it to the compounding pharmacy, and we'll just ship it directly to you. And I had that like within 5 days of making that request. Again, no additional cost. I didn't have to see the doctor again because she had just seen me, but they were able to add that because it is an all inclusive plan. So whatever you need to kind of get where you need to be with a hormone replacement, they're going to send to you, which I absolutely love and adore that particular style, because it's like if you need something, you need something, and the last thing we want is to be nickel and dime to death. So what I did is, they do ask you to pay for 3 months in advance, and so my 3 months of hormone replacement therapy was $567 or $189 per month, and I have been spending anywhere from 75 to 100, maybe just a little bit more on hormone replacement therapy with different providers, but I like knowing that the 189 includes that future testing, and I don't have to be nickel and dime to death when it comes to additional future tests to make sure things are okay. So again, I'm super pleased with that because that was important to me. Understand that, again, for the most part, Joy doesn't really accept insurance. The only exception to that rule would be is, if you're okay with a patch that's not bioidentical, or if you're okay with a progesterone pill that's not bioidentical, they may have some of those that they can write your prescription and email that to you, and you can take it to your local pharmacy. But again, it just depends on what you're looking for, what you need, and again, what your insurance will pay for. So I wouldn't count on it. I would kind of assume going into it that you will need to use your, just pay for it out of pocket, HSA card or credit card or whatever. I also really want to say that I am super pleased and really excited about the combination of my HRT, so my hormone replacement therapy, and using that semaglutide to lose weight. I feel like those two products together have been like the holy grail of what we in menopause need to lose those last 10, 15, 20 pounds that we just can't seem to get off. I have been on the semaglutide for 8 weeks, and I have lost, maybe 9 weeks, and I have lost 10 pounds. And believe me, I am super happy about that. And so if you're kind of in that place of, I need to get my hormones in line and I still need to lose some additional weight, I really suggest you talk to the Joy professionals, because knowing that they can do both products together is like, again, is like the cat's meow of hormone replacement therapy. The other thing I would recommend is, if you think you're going to do semaglutide, when you go to Joy to kind of get things started and you put the lab panel that you choose in your cart, go ahead and put the semaglutide in your cart too, either a 2 month, 4 month, 6 month, or 8 month supply in your cart. And when you check out using my coupon, you'll get 10% not only off of your labs, but you'll also get 10% off the semaglutide. And the semaglutide, I ended up paying, what was equivalent to $228 per month. I've heard of people saying they're spending $1,000 a month on Ozempic or some of those other, weight loss products. So to be paying less than $300 a month, I was super pleased with that. So just know you can use the coupon if you put it in your cart. If you wait and purchase after the fact, you can't get the 10% off. So you want to do that ahead of time. So I would say, when it comes to hormone replacement therapy, I would say of all of the companies I've tried so far, Joy Women's Wellness is by far my favorite. And I would say that as I go into next week, and so next week is my first follow-up, and it'll be about 10 weeks since I started. So I don't know if I'll see Dr. Brooke again or if it might be a different person, but I am interested to see their opinion of some of my lab work. So my first set of labs came back, and it looked like all my numbers are within reason, but they're at the high end of the kind of the averages. And I don't know if that's good or if that means there's too much. So I really am interested to have that first kind of follow-up appointment to see if they are going to recommend any dosage changes, if anything needs to be taken down a couple notches, or if they're perfectly fine with me being, again, kind of on the high end of the average for a woman who is 57 years old and clearly menopausal. So thank you for your time today. I really appreciate it. Come visit us at Hormone Therapy Hub on the web, and don't forget to use the coupon code below, and you can get 10% off of your lab work and 10% off of your semaglutide if you choose to. So thank you.